Hello everyone, my name is Dr. Hima Wankayala. I'm actually a medical oncologist. I practice out in Jacksonville, Florida. Thank you to Dr. Sirisha Patluri for giving me this opportunity and to bring in front of you the important matter of breast cancer screening, which is a very critical matter for many of us women. And I appreciate for giving this opportunity to me again. On the occasion of the International Women's Day, which is celebrated on March 8th this year. I'm going to give you a little history about the International Women's Day, why and how this all started. This is to celebrate women who have made significant contributions to the advancement of their gender, either socially, economically, culturally, or politically. Thank you to all these women who actually took a big toll on them and moved forward for the rest of the women, shining some light out there. Coming to the history, this started back in New York City in year 1908 when women who were working in the garment industry went on strike because of their poor working conditions and poor wages and mistreatment. And the National Women's Day was celebrated for the first time in US on February 28, 1909, which was spearheaded by the Socialist Party of America at that time. What is the campaign theme for year 2021? Is to choose to challenge. I would take the challenge to take ownership of our decisions, challenge to take care of ourselves physically and emotionally. How can we take care of ourselves physically? Few things I could think of and I can pass on to my listeners. Eating right, picking the right choices, eating fruits, vegetables, including multigrain and full grains in your diet. Last but not least is exercise and cancer screening. Cancer screening is very critical part as women age. How can we take care of ourselves emotionally? The first thing we need to do is we need to accept ourselves. We need to boost our confidence. We need to practice self-respect and self-compassion and mindfulness. Being mindful helps us to make right decisions at the right time and right way. Please raise your hand with me that you are in for this challenge of putting yourself first, participate in your health and cancer screening depending on your age and your risk factors. Let me quickly go over the statistics of breast cancer. As you can see in these two pyramids, in the year 2021, it is estimated that about 284,000 women will be diagnosed with breast cancer. At the same time, about 45,000 women will lose their lives for breast cancer in the year 2021, which is very sad, but which can be prevented with breast cancer screening. What is the estimated new cancer cases? If you see this pie chart, you see that about 30% of the new cancer cases in year 2021 are from breast cancer. So if you take 100 women, 30 out of 100 new cancer cases are secondary to breast cancer. This is a little table giving us an idea about our risk of breast cancer depending on how old we are. If you see in a 20-year-old woman, the risk is pretty low. 1 in 1,500 women will be diagnosed with breast cancer. But in age of 40 or age of 50, 1 in 60 to 1 in 40 women can be diagnosed with breast cancer. What is a lifetime risk? Which means a woman can develop breast cancer the time they're alive is 1 in 8. Let me quickly go over the anatomy of the female breast and where does cancer start. If you see, this is the nipple, the brown area around is called areola, and this is the fibrofatty breast tissue. So the breast tissue consists of fatty tissue, which is the fat in the yellow color, and the lobules make into lobes where the milk is made or milk is manufactured, and it is carried in the ducts or milk ducts to the nipple. What is cancer? Cancer is nothing but a very badly damaged cell. Our body is made up of trillions of building blocks called cell. Each cell has a genetic material in the center of the cell called nucleus. When the genetic material in the cell gets damaged, two things can happen. Either the cell will be repaired and goes back to function, or the cell will die. But sometimes the cell escapes the repair process and also the death process, and it is alive and doesn't behave normally, and it becomes a precancerous or a cancerous cell. And that is what, if it happens in the breast, either in the milk duct or in the lobule, women can develop breast cancer. I'm going to quickly go over the risk factors. What are the risk factors for breast cancer? The two things we can't avoid are gender, being a woman, and aging, which is getting old. These are the two risk factors which we can change. Along with this, about 5 to 10 out of 100 breast cancer cases occur because of the genes passed down the family we call hereditary cancer syndromes or inherited risk factors. Some of the genes which are identified are BRCA1 and BRCA2, where women in these families develop cancers like breast, ovary, pancreas, and men can develop prostate cancer, etc. Along with this, the family history is very important. What exactly family history means? Family history means either mom, sister, aunt on the mom's side or aunt on the dad's side, or any other family members, including men with a cancer and falls into certain criteria, increases the risk of cancer and also breast cancer. And how about personal history of breast cancer? What does that mean? A woman suffered with breast cancer in the past, the risk of developing a second breast cancer is higher than a woman who never experienced breast cancer. Some of the women receive radiation to their chest for other medical problems when they were young or in their early 20s. Over time, the risk of developing breast cancer increases. Coming to postmenopausal hormonal therapy, what does that mean? In menopause, women notice hot flashes, mood changes, and some of them take hormone therapy like estrogen supplements. And taking these supplements increase the risk of breast cancer. Some of the other factors which we can change and implement in our everyday living and reduces the risk of breast cancer are physical activity. Number 2, eating healthy. Number 3, maintaining ideal body weight appropriate for our height. These are the things we can do which can help reduce our risk of suffering and developing from breast cancer. Coming to Asian Indian and Pakistani Americans, risk of developing breast cancer. This is a very interesting study published in October 2020. by Dr. Jaya Satyagopan. They looked at women diagnosed between year 2000 and 2016 for about 16 years, anyone over 18 years of age and diagnosed with breast cancer. They identified about 5,000 women who are Asian Indian and Pakistani Americans, and about 480,000 women who are white, non-Hispanic white women. What they have noted was the number of breast cancers diagnosed in women who are Asian Indian or Pakistani American increased from 2.3% in year 2000 to 10% in year 2016. This is a big jump. When they looked at these women, what they have noted was women belonging to the Asian, Indian and Pakistani American women, they were diagnosed at a significantly younger age. They were also noted to have advanced stage diseases like stage 3, stage 4, and they were also noted to have more aggressive cancers. More studies are needed to identify these women and why they are developing these aggressive cancers at an younger age and more advanced stages. Given all this information, I think it is very important to have screening for breast cancer. Before we move on to that, what is a screening test? I want to tell you a little bit about that. A screening test is a test which looks for signs of the disease before a person develops any cancer symptoms. What is the main goal and the purpose? The main purpose is to find the cancer at an early stage where the cancer and the person can be cured of the cancer. And they identify before a person develops symptoms and when the cancer is very small. And what are the different screening tests available for breast cancer out there? Mammogram, and number 2 is MRI of the breast. What is a mammogram and what are the types of mammograms which are available? There's a 2-dimensional mammogram and also a 3-dimensional mammogram or tomosynthesis. MRI is a big magnetic resonance imaging, which actually there's without any radiation exposure. You have to talk to your primary care doctor, gynecologist, and depending on your age, depending on your risk factors, depending on your previous mammograms, your doctor will order one of these tests and the insurances will cover these screening tests. To just give you an idea how these machines look like, the one on the far left here is a 2-dimensional mammogram where the breast tissue is compressed in between 2 plates from top to bottom, side to side, and it will take pictures. And the one on the right is a 3-dimensional mammogram or tomosynthesis where the machine rotates and take multiple pictures of the breast tissue. And this number 3 is the MRI of the breast where a woman is laying down and there are cup holders which holds the breast tissue, and the MRI will take pictures of the breast. Why it is important to have the mammogram? Yes, mammogram reduce the breast cancer deaths, and because of this there's about a 40% reduction, 40% drop in the risk of dying from the breast cancer. So once a woman does a mammogram, what happens after that? So if 100 women goes to a screening mammogram, 90 out of 100 women will have a normal mammogram test, and the 10 will be contacted to come back for more additional testing where they take more pictures and ultrasound. And out of 10 women who were contacted to come back to repeat the test, only 2 will be recommended to have a needle biopsy. Depending on the woman's age, a younger woman The biopsy doesn't necessarily mean it is cancerous, because sometimes women have other breast diseases which are non-cancerous, which means they are not cancer. Or sometimes young women have the breast tissue which is dense. So recommending a needle biopsy not necessarily equal to having a breast cancer. So when do we start the screening? In the United States of America, there are different societies recommending screening at different ages. Depending on our age and our risk factors, our doctors have to recommend. If I were you, I would start screening at age 40, and depending on the initial test, further decision can be made about when and how often you need the testing to be done. Thank you again for giving me this opportunity. And Dr. Putluri, thanks for thinking of me and letting me have this conversation with this beautiful woman on the occasion of International Women's Day. And all the best to you all. And if you have any questions, you can always contact me or reach out to Dr. Putluri for further information. Thank you. All the best.